Okay, this video is called the Low-Fat Vegan Health Curves. And this is based on, from reading about the work of Dr. Walter Kempner, Dr. John McDougall, Dr. Anthony Lim, Barbara Newberg, who is partners with Walter Kempner. Dr. Anthony Lim is partners with Dr. John McDougall. Frank Nealon was partners with Walter Kempner and the Rice Diet over in Durham, North Carolina. Nathan Pritikin also was a very famous nutrition doctor where they would manage patients' blood pressure in a controlled setting, somewhat of an inpatient setting, if you will, whereby they could follow their blood pressure after an immediate change when they changed their diet. So here's what happened. Basically, as soon as the patient either fasted or switched from the standard American diet to a low-fat vegan diet, their blood pressure just dropped. So the blue curve is blood pressure drop, and it drops rapidly in a day. And what that proves is it's due to the food. That's highly relevant because the standard medical textbooks still say that 95%, really 95% is what they typically tell them. I just spoke to a medical student recently this past week, and they told me they are taught in the first and second year of medical school that 95% of hypertension is essential hypertension, idiopathic, of unknown cause. And it's ridiculous. All you have to do is stop food and boom, the pressure drops. Okay? Now, you don't even have to completely stop the food. Just change the low-fat vegan and the pressure drops. Okay, so we know that high fat contributes to that. We know that high sodium contributes to that. There's a third thing that contributes to that. I'm going to give a lecture about it soon. So anyways, the blue line is the rapid drop in blood pressure curve, and that's highly relevant, as Dr. John McDougall said and Dr. Frank Newell said, and as the other doctors in this group know, like Dr. Anthony Lim and whatnot, is that they have to begin reducing the blood pressure medicines in advance. And then get them off real fast, because otherwise their pressure could drop too low and they could pass out. Okay, so the first green curve, hyper green curve, almost fluorescent green curve, is the number of medications. You're going to stop some of those meds before you put them on low-fat vegan or you fast them. So the number of meds they're on drops very rapidly. It's routine that 90% of these patients, according to Dr. McDougall, Dr. Kempner, and Dr. And Nathan Pritikin, they get 90% of the patients off all their antihypertensive medicine. So polypharmacy comes to an abrupt end. All right, they rapidly decrease the number of meds. Blood pressure drops like a rock. Okay, so it's due to the food, because as Frank Nealon had pointed out, they don't lose the weight until later. They lose a little bit of weight initially, but it takes a long time to gradually get all that weight off their body. Okay, in addition, their blood glucose also rapidly drops. So again, it's because of their diet. It's not because there's intrinsically something wrong with them typically, okay? This is for type 2 diabetes I'm talking about. Type 1 is an autoimmune phenomenon. Type 1.5 is a mix. But type 2, which is by far the vast majority of diabetes, is due to the diet, okay? And so they also, as Dr. McDougall talked about extensively and Dr. Frank Nealon, and Dr. Anthony Lim has tons of experience with this, they have to get the patient off those diabetes medicines very quickly. Get them off before they change their diet, and then quickly take the remainder off if necessary. Okay, so anyways, the blood glucose drops very rapidly too. Again, like a rock, it's due to food, and they've shown it's due to eating a high-fat diet. Okay, this whole high-fat stuff is a big joke, and that's why I think moderate fat is a dangerous idea. Okay, low fat's the only thing proven to be optimal for health. Okay, then it takes longer for the hemoglobin A1C to come down, because that's a measure of blood glucose levels over the course of 120 days, which is 3 months, because a red blood cell lives 120 days, about 3 months. So you can see these curves. So it's rather dramatic. The first thing to drop is the number of medications they're on, because they stop them in advance, anticipating what's going to happen. Then their blood pressure drops, and then their blood glucose drops rapidly. We're talking in 1 to 2 days. This is a rapid drop. And then the hemoglobin A1C works its way down gradually. This graph over here is high levels of whatever the item is we're measuring, medium levels, and low levels. So the weight goes to medium, kind of slower. It takes a while to get down to low. But then for years, it'll remain fine if you just continue with a low-fat vegan diet. So anyways, I thought that was kind of interesting. It's just more proof the low-fat vegan diet's the way to go. Here's also some longevity curves I had laying around from a previous lecture, that the SAD diet patients are basically screwed. Their health goes into the garbage can, typically in their 40s sometimes, maybe not till their 50s, but I see all these guys eating the SAD diet, going for open heart surgery in their 50s, impotent in their 30s and 40s. They have a lot of problems, okay? They look like crap by the time they're 50. Okay, and then they usually die. They suffer terribly, and then they die at about, let's say, 65 or so. Sometimes they linger on, sort of like, pathetic, weak, unable to do anything. Mediterranean diet, which is your typical healthcare worker, they do a little bit better. Okay, so they'll, let's say they get to 75, but they're also typically pretty fat and sick by their mid 50s. I know the doctors, even some of the ones who are the best, super high IQs of over 150, and they're all messed up because they haven't studied nutrition, epidemiology, and toxicology. And the average doc is pretty routine that they don't age well. Okay, and here's a low-fat vegan curve. Okay, what you also see with the low-fat vegan curve is a much longer health span where you are pretty robust. Okay, eventually, we all get old and die, but they're usually going to be pretty robust over what I would call decrepit, at least until they're 80. Okay, if not longer than that. It was very common in the blue zones that these patients wouldn't go to a doctor until the last 5 or 10 years of their life. So you get a much longer health span than these other diet options when you go low-fat vegan with no oil. So anyways, I hope that was helpful.